Since 1999, the Everett Clinic has been undergoing an important cultural shift.
I've been working here for 30 years. I have seen a lot of change. I have seen the change from a physician-centered organization to patient-centered organization.
It's all about patient care.
You know, the culture is really based around the patient and their needs.
It helps the patients be more comfortable.
The doctor is always taking the extra time I need. They listen to my questions, and I haven't felt rushed.
They feel empowered.
I think it works really well.
The goal of Everett Clinic is to do what's right for each patient and for us to take ownership and say yes. And I see that happening day in and day out at the Everett Clinic.
Continually striving for patient-centered care is made easier by our core values. They are at the foundation of our responsive, integrated, quality health care.
Our core values are at the center of everything that we do. You're thinking about your patients, you're thinking about your coworkers, which are your friends, and you're thinking about the company as a whole.
They spend a lot of time, make a lot of effort to educate people on the core values and what our focus is and what our goals are.
Our core values make up the fabric that holds together our 250 physicians and 1,400 staff members. We do what is right for each patient. We provide an enriching and supportive workplace. Our team focuses on value, service, quality, and cost.
We are changing every day. We are looking at every aspect of every situation, of every job description, of every patient encounter to make sure that we are always changing to continually strive to be the best that we can be, not only for our patients but for our employees.
The importance of making these changes is that we build a better team and build a better model so that we can provide better care to our patients.
The Everett Clinic both empowers and encourages our people to look for ways to add value to the patient while adding efficiency to our high level of care.
Things that's actually really important is to empower everybody to be able to make decisions and make change.
I think there's a feeling that at the Everett Clinic, if you work there, you can speak your mind and it's appreciated.
You could walk into our administration department and ask to see Rick Cooper and they'd say, okay.
Everybody has different ideas, and that's what's great about getting a lot of people involved, is that there might be that one person that you would never expect has the best idea.
And actually most of the successful initiatives have really come from the people who are right there on the front lines, coming together and looking at what we're doing and coming up with solutions that rapidly spread throughout the rest of the organization.
I feel more productive and happier, and it feels pretty good to be able to know that you're part of a change and you're able to make a change in the Everett Clinic.
I didn't realize the amount of work that went in for my telephone call until I sat in the doctor's office.
One of the staff-driven improvements is a process we call One Call Does It All.
And the One Call Does It All is just great. I called into my doctor's office and I was surprised, just taken back, because she said, well, just a minute, I will go ask. And it was like, okay. And she went and asked and came back and I got my answer immediately.
The patient's call is now forwarded to a pool of nurses who have time and resources to answer the call right away. As a result, over 95% of calls are resolved in one call.
I've gotten a person every time and they've cheerfully gone and gotten the answer for me.
We know we're being more efficient because we actually measure the time that the patient goes through a process, and that has decreased, yet the results have gotten to the patient faster.
In discharge planning, the medical staff gave patients custom and printed discharge instructions. The number of patients calling back for clarification automatically decreased.
And we found with the summary, all our questions were answered right there. When we got home, we could review it. I went to the pain center and I actually could go in and say, well, look, here's a copy of all the medication that I've been taking without going to the pharmacy and requesting a printout.
Further innovative changes have brought continued long-term benefits to our patients. In 1 year, the Everett Clinic saw a 25% improvement in patients who received all recommended tests for chronic diseases, who achieved optimal control of each disease, and were completely up to date on all recommended preventative care.
I've been at the Everett Clinic since the early 80s. They have implemented several processes that have made it an experience that I enjoy.
Our staff believe at the Everett Clinic they actually can do something to improve the care that they give to patients. They're not just showing up to do a job, they're showing up to help make the workday better.
We do it because we know that we are not only providing an enriching workplace, but we're providing a service to our community.
Helping people is the most satisfying part of my job.
I am really excited to be working for such a progressive and dynamic company.
I think that we can all look forward to adding value to the patient experience.
I'm looking forward to learning new things and expanding my own abilities.
When we do it together, I just think that reinforces the commitment and the motivation to do things better.
You just need to jump right in with both feet and just do it.
I will never leave the clinic. I'm a lifer.
I'm excited to be part of it all.
This is a changing world and we have to change with it.
Change is a great thing because when it all started I had a full head of hair and now I have no hair. So it speeds things up in the morning. So change is great.
At the Everett Clinic, we do it because our people believe the journey towards excellence never ends. We do it because we can. We do it because our people make the Everett Clinic a national winner.